video, we are going to discuss how to monitor blood pressure of a person in a correct way. As we all know, blood pressure monitoring is one of the basic procedures which should be performed by a nurse. As we all know, there are four main vital signs. They are respiratory rate, pulse rate, body temperature and blood pressure. So, blood pressure is one of the principal vital signs we have to measure as a nurse. Blood pressure is a measure of the force that the heart uses to pump blood all around the body. Therefore, this is a routine procedure which is performed by the nurses and the doctors in each and every setup, such as hospitals, outpatient clinics and sometimes in the homes. Blood pressure of a normal healthy adult is 120 by 80 mercury millimeters. When the blood pressure is too low than the normal value, we consider that condition as hypotension and it can cause dizziness and falls, especially in elderly people. When the blood pressure level is too high than the normal level, we consider that condition as hypertension and it is a risk factor for cardiovascular diseases, and sometimes it may cause headache and various signs and symptoms. We use blood pressure as a vital parameter in monitoring a patient in emergency situation. As an example, hypotension can indicate sepsis or volume depletion of a critical patient, while hypertension can indicate pain or intracranial disease conditions. Therefore, blood pressure monitoring is a basic but necessary skill that a nurse should possess. Now, let's talk about the steps of the blood pressure monitoring procedure. First of all, we have to gather the necessary equipment. We will need a sphygmomanometer, that means the blood pressure monitor, and a stethoscope and also hand cleansing gel. It is very important to build up a good rapport with the patient when measuring blood pressure, because the anxiety level of the patient may affect for the reading. And also, some patients may have white coat syndrome, that means their blood pressure readings are higher when taken by a healthcare professional like a doctor. In order to build up a good rapport with the patient, it's very important to introduce ourselves to the patient and explain the procedure step by step while answering the questions of the patients, and we should explain that they may feel some discomfort when we inflate the cuff. Patient positioning is vital for correct blood pressure measurements. We can use sitting position or lying down position for this procedure. This is the correct sitting position for blood pressure monitoring. The arm should be resting and supported. Back also should be straight and supported. The cuff should be parallel to the heart level and the feet should be flat on the floor. The blood pressure monitor or the sphygmomanometer should be at the eye level of the nurse. As in each and every nursing procedure, in this procedure also, it's very important to wash our hands before the procedure, or else we can use an alcohol hand sanitizer to clean our hands. When selecting a cuff appropriate for the patient, we have to consider about the size of the patients. For the obese patients, we have to use a large cuff size, and for the children, there are separate pediatric BP cuffs. Next, we have to wrap the cuff around the upper arm of the patient. The arrow in the BP cuff should be in line with the brachial artery. We can palpate the brachial artery by feeling the brachial pulse. The distal end of the cuff should be placed 2 inches above the antecubital fossa. The correct placement of the cuff is crucial for correct measurement. Here in this image, you can see the brachial artery. First, we have to determine a rough value for the systolic blood pressure. This can be done by palpating the brachial or radial pulse and inflating the cuff until the pulse can no longer be felt. The reading at this point should be noted and the cuff should be deflated again. This is how we should inflate the cuff to determine a rough value for the systolic blood pressure. We have to palpate the brachial pulse or radial pulse for that. This should be done quickly as the patients may feel discomfort. Now we can measure the true BP value. For that, first we have to place the diaphragm of the stethoscope on the brachial artery and re-inflate the cuff to 20 to 30 mercury millimeters higher than the estimated value taken before. Then we have to deflate the cuff at 2 to 3 mercury millimeters per second until we hear the first Korokov sound, and we consider that moment and that reading as the systolic blood pressure. We have to continue to deflate the cuff until the sound disappears. The reading of the fifth Korokov sound is considered as the diastolic blood pressure. Make sure to keep the sphygmomanometer in the eye level when you are taking the measurements. Now you can record the true blood pressure as the systolic blood pressure and the diastolic blood pressure. If we want to examine postural hypotension, we have to take the blood pressure in the standing position. If there is a significant blood pressure drop, that means if the blood pressure drop is more than 20 mercury millimeter in standing position, we consider that condition as a postural hypotension. It's a very good practice if we can inform the blood pressure reading to the patient after taking the measurements, and we have to thank the patient for the cooperation, and also we can inform the patient whether the blood pressure reading is normal or not. If the blood pressure reading is not normal, it's better to recheck the blood pressure. If it is not normal further, we have to refer the patient to a physician and advise the patient to monitor the blood pressure regularly. This is for your general knowledge. Korokov sounds are the sounds that medical personnel listen for when they are taking blood pressure using a non-invasive procedure. They are named after Nikolai Korokov, a Russian physician who discovered them in 1905 when he was working at the Imperial Medical Academy in St. Petersburg, the Russian Empire. This is how we hear Korokov sound in the stethoscope. When we hear the first Korokov sound, we have to take the reading and it is the systolic blood pressure. And when we hear the fifth Korokov sound, we have to take the reading. It is the diastolic blood pressure. Usually, the fifth Korokov sound is followed by the silence. Okay, this is the end of the video, and thank you very much for watching this video. If you like to watch our videos, please subscribe our channel and press the bell icon.